So I received word today that I'll commence chemotherapy next Tuesday, so that's only 6 days away, which seems very, very soon. I've had, I guess, at least a month of knowing that this was coming, but now that it's arrived, it's a little bit scary. So Friday, 2 days' time, I'll go into the hospital and have an infuser port installed. So this is a little port that sits just below your skin near the clavicle, and that allows them to deliver the chemotherapy drugs intravenously. Apparently the peripheral veins, like in your arms, don't cope with the drugs too well. So that'll be done Friday, and then chemo Tuesday. For me, it's going to be every 2 weeks. I'll go in on a Tuesday, have one drug delivered over 4 hours. Then the following day, go back in to get a second drug via infusion. So take home a device that slowly delivers the drug over a period of 24 hours, and return to the hospital on the third day to have that removed. So it's kind of 3 days in a row of back and forth to the hospital, and every 2 weeks for 6 months, so 12 rounds, and that's the plan at this stage. So that's ahead. I lost about 7 kilograms in weight while I was in the hospital during my surgery, and I was pretty lean before, so it was mostly muscle that I lost. And so it'll be interesting to see how I change or continue to change over the next 6 months with the chemo. And I've been told that these drugs that I will be having don't cause hair loss. So I don't know, I've been the last couple of years a bit paranoid, thinking I was starting to go a little bit, but and thinking, oh well, chemo will be a good excuse, but no such luck. So we'll see how that goes. And nausea, they say 9 out of 10 people can be well controlled with medication. So hopefully I won't have issues with that. But mostly fatigue, I believe, is the issue. So some interesting times ahead.